just want to emphasize a couple of points that Doug made, and also make a pitch, I guess, to our younger folks. Right now, in the last 14 days, more than half of the cases that have been diagnosed in people less than 35 years old. In fact, 24% of the cases diagnosed in the last 2 weeks have been children less than 18 years of age. When we look at the proportion of the population that more than 50% of the people in the age group are vaccinated, that begins at age 45. So people 45 years and older only represented 31% of cases in the last month. But people 44 years of age and younger represented 68% of all the cases that occurred in our community in the last 30 days. So everything is moving toward the younger population. And the things that you may have heard people say on social media or in the media on TV, over the last year, a lot of the talking points that various pundits had was, well, it's not that big a deal if you get sick if you're young. It's not going to kill you. That's not entirely true. But what is being left out of those talking points that some people have argued over the past 15 months, that illnesses in younger people are not something to be concerned about, doesn't really take into account all of the impacts, the negative impacts on your life that having a long-haul COVID infection and fight against COVID disease can take on you financially, mentally, psychologically, and physically. Because it's true that younger people with a strong immune system are more likely to survive COVID infection. That is true. But they may still develop long-haul COVID and have illness effects that last for months. The virus still does tremendous damage to the lungs, scarring the lungs, and leaving you more susceptible to other kinds of diseases later that may follow. It's financially ruinous to wind up in the hospital for weeks at a time in an intensive care unit. So there are a lot of reasons besides the fear of death to get a vaccine. The vaccine can stop you from having severe illness. The vaccine can stop you from having to wind up in the hospital. It can also mean that if you are out and about and you do get exposed, you don't have to quarantine. You've been vaccinated. You don't have to stay home. You can go to work. You can be about the world doing your business, even if you get exposed, if you're fully vaccinated.